Welcome back, everyone. Today's show is all about having a fabulous fall because you know what? The snow is going to be falling before you know it, so get out there and enjoy it. But it's certainly hard to have any kind of fabulousness. I'm not sure if that's a word if you're suffering from chronic pain. And a lot of people just, you know, they just do every day, and they don't do anything to seek help. And you know what? There is help out there. And Dr. Doug Gateman from Aascend Pain Institute in Appleton is here every once in a while to talk about all different things I have never heard of and maybe you've never heard of that can actually help with, you know, people's different aches and pains. Good to see you, Doctor.
Thanks for having me again.
I tell you, I think there are so many people that every day wake up and it's just hard for them to get out of bed. It's hard for them to do everyday stuff, enjoy their grandchildren, just do the little things because they've got this something going on no matter what the pain is. And there are so many different ways that you guys can help alleviate it.
Yeah, correct. I mean, especially change of weather. Like this is the fall show. When weather changes, everyone's aches and pains come out. My patients laugh at me because I have aches and pains too, so I hobble. So what we try to do is mostly arthritis that we're talking about lately. And today what we'll show is how we treat arthritis long term if the back's not responding to what we normally do. So what we do today is called radiofrequency ablation. So the previous show, we actually put medicine in the joints, just like a knee joint. Just put a medicine in the joints, try to calm the inflammation down. That usually puts it in remission, doesn't fix the problem, just puts it in remission for long term. That plus physical therapy, chiropractic, a lot of stuff keeps it nice and calmed down. Now, if the joint is so worn out, it's bone on bone, well, our knees, we get knee replacements, our back, we haven't had that one yet. So what we do is there's a little nerve in there that we numb, and that nerve, all it does is make you feel that joint. So when that joint doesn't hurt, the muscles relax. And it usually takes people's pain from, they rate it from 0 to 10, coming in at 8, brings it down to a 2 or 3.
Wow.
So it lasts anywhere from 6 months to a year. And the older you are, the longer it lasts because that nerve regenerates. So it was a good one for prolonging the relief. It's not fixing the problem. Like I said, I mask pain.
Sure.
But it gets you more active, gets you going more, and it works really well when someone who knows what they're doing, because there's a few people out there, not so swift, but if you've done it for a lot, they worked really well. And so that's one of the things we do to try to prolong it, to make it last much longer.
So what's the, like, you come to the office, what's the procedure? Is it pretty quick in and out, or is it?
This one takes a while. Most of my procedures are pretty quick in and out. This one, because you really want to find that nerve. And I tell my patients, this is one of those that you might feel a little bit, because I try to make it so you don't feel anything. But we have to find the nerve. So it takes a little while, find the nerve, then we numb it all up, and then what we do is just heat up the nerve, and it damages the nerve, and then you can't feel the joint. And that the nerve sort of stops working anywhere from a couple of days to weeks down the road. The pain just sort of fades away. So it works pretty well.
But a few hours, is that maybe what we're talking about? Or
oh, no, this one usually is about an hour.
About an hour?
Yeah.
Okay.
We schedule about an hour.
Pretty quick, I mean, when you're talking about...
It depends on how easy it is. If it's had a lot of surgeries and stuff, we have to go through scar tissue. If there's no surgeries, we could actually do it in 20 minutes. But we give us an hour just in case you run into problems. We have to find it and stuff like that. So.
I always love hearing about the results. So give me a story of somebody that's really helped.
Well, a lot of my patients will come in and they just can't move. So what it does, and I tell people, is go and reduce it. They'll come in and we'll do the joints. Now, people have had fusions. Well, fusions work fantastic, but the joints above it get irritated. Well, either get another fusion and fuse that joint. But what we do is make that joint numb. The pain goes way down. I've had patients who, they'll come in the fall and the spring just to figure out what they want to do for the golf season or the winter season so we can sort of game it. The other people who go to Florida, I have a lot of people coming in just before they leave for Florida. So they have a great winter season down in Florida.
Why not? You know, if you're going to be down there hanging out, enjoying yourself, don't want to have the pain. And this is just one treatment. You've got you know, everybody's different, but there's just so many different treatments out there.
Lots of things we do. Now, what we've been talking about lately is just mainly stuff that we do, basic stuff. What we're going to do in the future is talk about how allergies affect pain, how we treat allergies without shots. Sleeping problems. People can't sleep, pain increases. We use chiropractic quite a bit. We'll talk about chiropractic. We'll also talk about acupuncture. A lot of different things we use to treat pain, not just physical therapy, shots, and run. So we do a lot of stuff, and everything sort of brings pain down. So a little bit of this, a little bit of that, works fantastic.
All right. Bottom line, you don't have to live with the pain. You know, at least get out there and find out your options.
Exactly.
Thanks. Dr. Doug Gateman from the Aascend Pain Institute in Appleton, or in the Valley. Good to see you.
Thank you.